Morning students. Now we will discuss about the second condition in Croup syndrome, that is acute epiglottitis. So we have already seen that in Croup syndrome there are four manifestations which can be seen commonly in four upper respiratory tract diseases, and the first one was acute laryngotracheobronchitis and the second one is acute epiglottitis. You can see the inflamed epiglottitis in inflamed epiglottis in this picture. So this is the again the part of upper airway. So acute epiglottitis is very clear. It is an obstructive inflammatory process that occurs principally in children, and it is obstruction is the happening in the epiglottis. So obstruction is supraglottic as opposed to the obstruction in the laryngitis. So it is in the supraepiglottic area. So the particular part above the epiglottis will be affected more than the down part. So that is about the epiglottitis. So regarding the incidence occurs in children between 2 and 5 years of age. Comparing to the acute laryngotracheobronchitis, it was more common among small children like 6 months and above. But now it is very common in 2 and 5 years of age. So there is some differences between these all diseases also. Regarding the etiology, it is more common with Haemophilus influenza virus, and that is regarding the etiology. And the manifestations already we have discussed, pathophysiology we have already discussed in it is also most of the same things happens in epiglottitis also, that is obstruction and airway hunger and struggle will be occurring in the epiglottic area, and the air is not able to enter into the lung and lower airway. So that is the main problem here also. So the clinical manifestations of epiglottitis is there will be sore throat and pain on swallowing will be the fever will be the child appears sicker, irritable, extremely restless, anxious and frightened, and the child will have thick and muffled voice. Suprasternal and substernal retractions can be seen, and this is a tripod position how the child is sitting. So the baby will be more comfortable in assuming this tripod position. So that is sitting slightly leaning forward and holding at the knees. So this is the means most of the child will be assuming tripod position. Because of this air hunger, child may not be able to sit in other positions or lie down. So child will be more comfortable in tripod position. The position is known as tripod position, TRIPOD position. Then there will be drooling of saliva because the child is not able to swallow anything. So drooling will be there. Severe respiratory distress will be there, and frog-like croaking sound on inspiration. Like this epiglottis is very much inflamed, and it will be creating a frog-like sound when the child is doing inspiration. So there will be three important other clinical observations. There will be absence of spontaneous cough. The child will not cough, or there will not be spontaneous cough. We have to ask the child to cough, then only the child will be able to cough. Then presence of drooling will be there, and agitation. Very much distressed and agitated the child will be. So diagnostic measures, history collection can be done, and physical examination can be done, like throat is red, inflamed, large cherry red edematous epiglottis is visible. When you are observing the mouth, we can see these all changes in the mouth of the baby. ABG analysis can be done, and to identify the hypoxia. Complete blood count, throat culture also can be taken to identify the organism. Management: if the child is suspected of epiglottitis, throat inspection only when immediate intubation can be performed. Because when we are doing a throat inspection or any touching in the throat or any procedure we are doing, immediately the child will go for laryngospasm and respiratory arrest, because the epiglottis will be closing and the child will be going for the respiratory failure. So we should not inspect or do any procedure if we don't have immediate intubation facilities. Then place the child in oxygen saturation monitor, and usually we do is endotracheal intubation or tracheostomy may be required, because in the epiglottis area there is inflammation, so tubes cannot pass. So usually what we do is tracheostomy, and intravenous antibiotics followed by oral administration, and corticosteroids are administered to relieve the edema and other discomforts at the epiglottis. And usually the child will be positioned in tripod position, as we already discussed in the previous slide. So these are the management, and usually we can do prevention of epiglottis with the Hib vaccine, Haemophilus influenza type B vaccine. That is, we are administering already. Immunization നിങ്ങൾ പഠിച്ചതാണ്. അത് നമ്മൾ സാധാരണ 6 weeks, 10 weeks, 14 weeksൽ നമ്മൾ സാധാരണ പെൻഡാവാലൻ്റ് ഇഞ്ചക്ഷൻ്റെ ഒപ്പം നമ്മൾ ഹിബും കൂടി കൊടുക്കുന്നുണ്ട്. 5 മെഡിസിൻസ് ആണ് കൊടുക്കുന്നത്, അതിൽ ഒരെണ്ണമാണ് ഹിബ്. So this is the prevention. So this is one of the emergency situation, and it's very hazardous condition for the baby. So we are doing Hib vaccine in order to prevent the Haemophilus influenza virus and epiglottitis. So this is about the prevention. Nursing management can be like, it is common for any group: ineffective breathing pattern related to inflammatory process, ineffective airway clearance related to mechanical obstruction, fear and anxiety related to difficulty breathing, activity intolerance related to imbalance between oxygen supply and demand. So these are the nursing management. And the third disease condition which is in the group is acute spasmodic laryngitis. So this is otherwise known as spasmodic group, midnight group, twilight group. These are the other names which we give for acute spasmodic laryngitis. Here it will be characterized by paroxysmal episodes of laryngeal obstruction that occur chiefly at night. So acute spasmodic, so spasmodic means that episodes of obstruction, spasm will be occurring, and that will be more commonly at night. So this is an important or very characteristic feature of the spasmodic laryngitis. So repeated episodes of spasms will be there in the respiratory tract. There will be obstruction will be occurring, and usually it is happening at the night time. Regarding the etiology, again viruses like adenovirus, influenza virus, rhinovirus, parainfluenza virus, respiratory syncytial virus. So these are the common viruses which we expect to cause acute spasmodic laryngitis. Next we can see the clinical manifestation. So usually the child goes to bed well or with some very mild symptoms, respiratory symptoms. So maybe the child will be going with this running nose or very simple sore throat or something, and child will be normal and they will be going and sleeping, but awake suddenly with characteristic barking, metallic cough, hoarseness, noisy respirations and restlessness. But when the spasm is occurring at night during sleep, child suddenly awakes and wakes up, and child will start barking, cough and hoarseness and respiratory difficulties will be present, and the child will be very much restless. And dyspnea is aggravated with anxiety, and there may not be fever, but these respiratory difficulties may subside within few hours, and the child will appear well in the next day. So this is the manifestations of acute spasmodic laryngitis. So during sleep and after sleep for 2-3 hours, the child will be giving these manifestations. So the management usually can be managed in home by cool mist. So some hot water air can be given for the child, or steam from hot running water in a closed bathroom. It may be helpful. Humidification, this is a procedure which we do, humidification. Advised to sleep in humidified air, and corticosteroid therapy can be given. These are the management for acute spasmodic laryngitis. So the next condition is The fourth Croup syndrome, the fourth condition in the Croup syndrome is bacterial tracheitis. So, infection of the mucosa of upper trachea with features of both Croup and epiglottitis. So, this is the bacterial tracheitis. So, super added infection. നമ്മൾ ഓൾറെഡി കണ്ടിട്ടുണ്ടായിരുന്നു ഇതെല്ലാം എന്തുകൊണ്ടാണ് കോസ് ചെയ്യുന്നത് വൈറസാണ്. സോ വെൻ ദിസ് ഈസ് കോംപ്ലിക്കേറ്റഡ് and it is infected, then it is known as the bacterial tracheitis. So infection of the mucosa of the upper trachea with features of both Croup and epiglottitis. So it is complicated form of acute laryngotracheitis and other conditions, epiglottitis. So it is a complication of laryngotracheobronchitis. So there is a superadded infection is occurring. So the incidence is common in 1 month to 6 years old children. Very small children, it is very commonly seen. And etiology you can notice now it is viral etiology is replaced with bacteria. So before it was a laryngotracheobronchitis with virus infection or epiglottitis with a virus infection. Now it is complicated with again infected with bacteria, then it becomes the bacterial tracheitis. So Staphylococcus aureus, group A, beta hemolytic streptococci, Haemophilus influenza, again it can cause the bacterial tracheitis. So it is the superadded infection or the complication of previously discussed Croup syndromes. Then manifestations of laryngotracheobronchitis, but it is unresponsive to treatment of laryngotracheobronchitis. So this is not treatable because the viral treatment is not proper for bacterial infection. Now we have to start the antibiotics. History of upper respiratory tract infection will be there, croupies, cough will be there, stridor will be there, high fever will be there because of the bacterial infection. Production of thick purulent tracheal secretions can be seen. Respiratory arrest may occur. So the next is management. Usually we administer humidified oxygen is required, and in some conditions AT intubation and other respiratory support is also required. Antipyretics and antibiotic treatment because it is again infection with the bacteria may require AT intubation and frequent tracheal suctioning. So this is about the management of bacterial tracheitis. So till now we discussed about the Croup syndrome. So first you have to understand that Croup, it is a term used for symptom complex. So there are 4 symptoms in Croup. That is hoarseness of the hoarseness, inspiratory stridor, then metallic cough, that is barking or resonant cough, and inspiratory stridor. So or respiratory distress. So these manifestations will be common in upper respiratory infections, and these all Croup syndromes are of 4 types. That is acute laryngotracheobronchitis, epiglottitis, then acute spasmodic laryngitis, and last one is bacterial tracheitis. So hope you understood. And the first 3 is because of primarily because of virus, and the last one is it is superadded infection of bacteria. The viral infection is complicated with the bacterial infection. Hope you understood.